Welcome to our office. We are happy and honored that you've chosen us to address your healthcare concerns. And if you're here, are you suffering from chronic knee pain, swelling, or stiffness? If so, rest assured, you are in the right place. So let's look at what we are going to accomplish together on your visit with us today. First, we are going to cover exactly what will take place in your evaluation. Then we'll discuss briefly, what is chronic knee pain? What are the signs and symptoms? What are the causes, etc. All so that you can have a better understanding of this condition that's impacting your life. We'll talk about quick stats on knee pain. Next, we'll explain how we evaluate knee pain. Then, let's dive into how we determine whether you're a good candidate for our specific protocol. And finally, we'll talk about what's next for you and your path to recovery. So, let's talk about your evaluation today and exactly what will take place. The doctor will be in shortly, and he will start off with your consultation. This is where you'll tell him exactly what you're experiencing. He'll ask about your health history and just get a better understanding of what's been going on with you leading up to this point. Next, the doctor will do a thorough examination and explaining how certain tests, if positive, help us correctly diagnose your condition. He will most likely recommend X-rays or potentially refer out for an MRI. If you already have imaging, he will review that with you. And finally, the doctor's report of findings. This is where your doctor is going to explain in detail what was found, the severity of your condition, and whether we feel that we can accept you as a patient. The report of findings may happen today or in a subsequent visit, but one thing to keep in mind is that it's important to have your spouse present if possible, because if the doctor feels he can help you, we'll be discussing the schedule of treatment, insurance, and finances. So chronic knee pain can actually result from issues in the knee joint itself, or even in the hip. Most commonly, it's due to injuries or age, both of which we'll discuss in more depth shortly. From a structural standpoint, the knee has 3 articulating bones: the femur, which is the thigh bone, the tibia, your shin bone, and the patella. On top of the tibia head is the meniscus. Actually, there's 2 of them, one inside and one outside. There are fluid-filled sacs called bursa, and these act as shock absorbers along with the menisci. Generally, pain will be felt in the front, but it can also be on the sides or back, which is less common. Now let's talk about signs and symptoms from chronic knee pain. And you're probably familiar with some of these, but the most common are pain, swelling, burning, stiffness, and even a clicking sound. All these symptoms can be mild, moderate, or severe. It all just depends on the severity of the condition and the length of time that the condition has been going on, which is why it's so important to address this as soon as possible. The sooner we can treat the condition, typically the better outcomes the patient will experience. Now let's talk about causes. 2 of the most common causes are sprains or strains to the ligaments or osteoarthritis, which is age-related and sometimes referred to as degenerative joint disease, which is a breakdown of the joint structure. Patellofemoral syndrome is not as common and will be felt at the front of the knee. Overuse syndrome is where you will get inflammation of the soft tissue components like tendinitis, bursitis, etc. Of course, fractures and trauma, but that's not something we would treat in this office. And finally, gout, which again is not something that we treat. Overall, we focus on strains or sprains, meniscus issues, and osteoarthritis, which are some of the most common causes, and we get great results in these situations. So, how do we assess chronic knee pain? Well, of course, we start with a standard health history, as well as a thorough orthopedic and neurologic examination. We will also need imaging. Typically, X-rays will be sufficient, but if your case is more complicated, we may order an MRI as well. Based on all of this information, we will be able to definitively diagnose your condition, the severity, and we'll know whether we can help you or not. Here's great news. In our office, the doctor has invested a tremendous amount of time, energy, and resources to offer what's called laser knee relief. This comprehensive protocol offers therapies that are non-surgical, drug-free, highly effective, and FDA cleared. It starts with Class 4 laser therapy, which flushes out inflammation and increases the amount of healing oxygen and nutrients to the injured site. Knee decompression opens up the joint space to help with flushing out the inflammation and creating access to the joint space. Bracing helps to stabilize the knee joint throughout the treatment protocol, so the patient doesn't inadvertently re-injure the joint. Supplementation helps to speed up the healing process, and orthotics give the proper foundation to the feet so the knees can sit properly without leaning in or out. So, how do we determine if you're a good candidate? The doctor will take several factors into consideration, such as your overall health history, your age, the orthopedic and neurological test results, and your imaging results, whether that was an X-ray or MRI. Based on all this information, the doctor will let you know whether he can help you with laser knee relief, and if so, what he recommends for a treatment plan. So, what's next? Well, at this point, the doctor will be in shortly to begin your evaluation. But we hope that this information has started to give you a foundation of knowledge so that you can make a well-informed decision about the future of your health. Once the doctor has completed the evaluation, he will then let you know if you're a good candidate for care, and if so, will give you his recommendations for moving forward. Again, thank you so much for choosing our office, and we wish you the best in health.